excited to introduce Sherrill Wayland to you. Sherrill is a great friend of Washington University. He's a graduate of the Brown School of Social Work. As you can see in the back of her picture, she is the Director of National Education Initiatives for SAGE. And as you can see, SAGE is Advocacy and Services for LGBT Elders. Sherrill is in charge of many things in this role. One of the things she's worked on is an equality index for long-term care in terms of equity for all residents of long-term care. And she manages operations for training and credentialing in that program as well. She is head of the National Resource Center for LGBT Aging, another very important resource in this country. She started the local SAGE chapter when she graduated from WashU and took that into existence and fruition. And she did a merger with SAGE and PROMO, Missouri Statewide Equality Organization, PROMO, before she went national with SAGE. So she's in a national position with SAGE now, a very influential leader in this field. So pleased that she's a good friend of our school. So Sherrill, thank you for being here with us today. We look forward to your talk, and we'll save room for some discussion at the end.
So again, just want to thank Nancy and Natalie and Emily for this opportunity to be here today and speak with you all today. As Nancy said, I'm the Director of National Education Initiatives at SAGE, where a large part of my job is managing the National Resource Center on LGBT aging. And so today I'm going to speak to you about the future of LGBTQ aging. And, just feel free to, record your questions as we go through the conversation today. So the National Resource Center on LGBT aging is the first and only National Resource Center established specifically for supporting LGBTQ older adults, their caregivers, as well as the aging network across the country. And we are a program of SAGE, which is the largest and oldest organization dedicated specifically to LGBTQ plus aging. You may notice that we're starting to use LGBTQ plus in how we speak about LGBTQ aging. And up until this year, we did not include the Q. And I wanted to note that because it is something new for us at SAGE. And part of that is because historically, Q has represented queer. And for many LGBTQ older adults, the word queer was seen as very derogatory and oftentimes used as a put down for LGBTQ folks. It may have been yelled at folks or used to intimidate and sometimes during acts of violence towards LGBTQ older adults. And so it was until just recently that folks weren't comfortable with including the Q within an older adult perspective. And we did research over the past couple of years and currently found that LGBTQ older adults are more comfortable with us including Q as how we identify LGBTQ older adults. So you'll now see that used interchangeably throughout our presentation. And so I just wanted to start out with that because it is something new for us, and sometimes I'll go back and forth in my presentation. So what do we know about LGBTQ older adults? We know that the population at around 2015 was seen to be around 3 million older adults who identified as LGBTQ. And just as the older adult population as a whole is growing, so are those that identify as LGBTQ. So by 2030, we're estimating that there's going to be upwards of 7 million LGBTQ older adults who openly identify as part of the community. And, so we want to really encourage folks to think about, the fact that you're more than likely serving LGBTQ older adults today. They may or may not be out in the service sector, but we encourage you to really start to think about, the fact that you are serving LGBTQ older adults, and what are you doing internally with your organizations and the work that you do to make sure that LGBTQ older adults feel welcomed and supported in your services. So here are some of the things that we know about LGBTQ aging. We did a study back in 2014, and this study continues to be relevant today. It found that many older adults are experiencing a shrinking social network. They oftentimes have, really come to rely on families of choice who more often than not are of the same age. And so when you think about, two older, couples who are both, both couples are in their 80s, when one person starts to experience health concerns, this can really have a domino effect of the supports that are available for the folks in that, close-knit family of choice. And so this has become an increasing concern, for us as we start to see these social networks shrinking. And it really makes us wonder, who's going to be there to help support our LGBTQ older adults. We also found that there's a high rate of discrimination within housing, and this includes senior housing. And so again, this is a concern. LGBTQ older adults are less likely to have children, more likely to rely on families of choice, and oftentimes the social service network. If they're experiencing housing discrimination within aging services, then it brings about a big concern of who's going to be there to support them. And are they even going to feel comfortable to access these services? This leads to an ongoing fear of disclosure, disclosing their sexual orientation, their gender identity, disclosing, who's going to be there to help support them as they age. And so with this fear of disclosing and actual experiences with discrimination, we continue to see an older adult population who remains very vulnerable as they age. We developed a new fact sheet over the last year called Facts on LGBT Aging. You can download this fact sheet on our website at lgbtagingcenter.org, and it will really give you an in-depth look of many of the most recent, facts that are out there that really speak to the LGBT aging experience. And this slide deck is available to be shared afterwards with the attendees today, so you'll get direct links to the resources that we're talking about as we go through the presentation. As with all older adult communities, we've really seen how COVID has impacted our communities. And within the LGBTQ community, we've really seen this exasperation of, the impact of COVID, especially on our communities of color. And some of what we have found through research that was done in 2020 on these impacts was an increase in social isolation, a reliance on chosen families, a concern that many of our LGBTQ older adults were residing in long-term care communities, which we know, we're really at the epicenter for, the early COVID infection rates, and a lot of, health disparities that were already high for LGBTQ older adults, just became increasingly high with COVID and ongoing complications. We also saw that, there was this lack of access for LGBT welcoming health services. So folks were already, concerned about accessing services. And then we have, this real public health crisis that has happened. So, it was a concern that people were not going to feel comfortable to access services as we, went through the pandemic. And then financial insecurity. One of the things that we've been able to really see take off over the past 2 years is our National LGBT Elder Hotline. And this is a program that runs 24/7. It's available in English and Spanish, and it's a national hotline that's in collaboration with United Way Worldwide. And one of the things that we saw in there were the types of calls that were coming in. And by and large, these calls were folks in crisis. They were, facing income insecurity for rent and food. And so there were oftentimes a number of referrals that were, trying to get people connected with those local services in their community for rental assistance and nutrition services. We also saw a lot of mental health concerns, depression, anxiety, suicidology. All of these concerns were just really picking up during the pandemic. And prior to the pandemic, we were seeing about 20 to 30 calls a month. And this past month in October, we saw over 300 calls. And so the numbers just continue to rise of people reaching out for services who are struggling with, meeting day-to-day needs and also just needing a friendly voice to speak with. So, all of these things that we talk about here are part of what we're seeing coming into our hotline. And, just thankful that we do have this resource available, and I'll share some resources later in the presentation today. So I want to talk about, the future of LGBTQ aging and where we've been and where we are now. So, it's important that we understand some of the disparities that impact the LGBTQ community and some of the concerns that continue to be here and how we got to where we are today. So the National Resource Center on LGBT Aging, it was started in 2010 with funding from the ACL, the Administration for Community Living, and through the Older Americans Act. And we just finished our 10th year of operation for the National Resource Center in 2020. And during that time, we've had a lot of developments that have happened that really help to support LGBTQ inclusion across the country. In 2012, ACL for the first time shared that area agencies on aging and state units on aging can start to recognize LGBTQ older adults as a population of greatest social need. This allows area agencies on aging and state units on aging to really focus in on the needs of LGBTQ older adults through outreach and services, and to make sure that funding is also there to support the needs of LGBTQ older adults. During 2015 and 2016, we met with a number of key stakeholders across the country to really, see what we can do as an organization to help support their inclusion of LGBTQ older adults. This work led to a guide, a best practice guide that was produced in 2016 that really helps to set out best practices for the Aging Network and state units on aging as they start to develop their state and area plans and start to do outreach and services for older adults, including those who identify as LGBTQ. And then finally, in 2020, with the reauthorization of the Older Americans Act, we saw for the first time an act that has steps for true inclusion around LGBTQ plus older adults. And so that's really one of the areas that I want to spend some time with today as we think about the future of LGBTQ plus aging. This future, really, it's all about you. We've helped to set the groundwork for this work. We've helped to develop best practices and resources that support the Aging Network and being more inclusive. And so when I was thinking about, this presentation today, one of the things I really wanted to focus on is how, those of you working in aging services can make sure that you're truly being inclusive of LGBTQ older adults. The future of healthy aging, of wellness, of inclusion is really up to you. And so I want to encourage you to think about steps that you can take in your own work to be more LGBTQ plus inclusive. We talked about the LGBTQ plus inclusive Older Americans Act. So what is it and what does it really mean? The Older Americans Act now encourages and really calls on state plans and area plans to engage in outreach to LGBTQ plus communities, to start collecting data on the needs of LGBTQ plus older adults, and to describe in state and area plans how these needs are going to be met. This is the first time that we're receiving this level of guidance through the Older Americans Act. And I was just on a call earlier today with members from the state of Missouri, as well as some of our area agencies on aging here in Missouri, and they were talking about, doing focus groups on LGBTQ plus communities. This is happening across the country right now. We have more and more state plans on aging and area agencies on aging that are truly taking the time to commit to LGBTQ plus inclusivity and say, how do we serve our LGBTQ plus communities? How do we really start to understand their needs? And how do we make sure that we're meeting these needs across the country? And so I'm really encouraged to see this work starting to take off across the country and here in my home state in Missouri. So when we think about the future of aging, and not just LGBTQ plus aging, but all aging, it really is about diversity, equity, and belonging. And I think, one of the things that has happened on a positive note through this pandemic is that, we're really starting to think about how we can be more intentional. How do we make sure that we're really meeting the needs of those most vulnerable within our communities? And, this oftentimes is our minority communities. And, the intersections are there. And it's important that we really take the time to understand, what can we do from that organizational perspective and from a professional perspective to live and be committed to diversity, equity, and belonging. So on the next few slides, I want to share what some of those resources are that are there to support you in your work and service for older adults, inclusive of LGBTQ older adults. As I stated in 2016, we developed a guide for state units on aging and area agencies on aging. This guide was designed to really speak to, strengthening the outreach and service to LGBTQ older adults and making it a part of those area and state plans. This guide includes success stories, so it really draws upon the experiences of other states and area agencies on aging who have been doing this successful work for a number of years. It provides key data and links to other research that, folks can use in developing their own, service plans, whether it's for an area agency on aging or another nonprofit. We give examples of how these goals can be written and how the strategies can be implemented. And then we follow up with best practices. When we were working on this guide, one of the key components that we received from the Aging Network was, don't just tell us what to do, but be a partner with us and share with us how we can make this possible, how we can accomplish these goals. And so that's really what we tried to do inside of this guide. And I would encourage you, again, to download this guide and see how it can be used in your communities. Another resource that we developed, I believe this was done in 2019. This guide was done in partnership with a group of minority organizations who serve Hispanic Latino older adults, Asian Pacific Island older adults, American Indian and Alaskan Native older adults, as well as Black and people of color older adults. And, this guide really looks at the intersectionality of aging and disability. Again, there's so much more to us than, one identity. And when we think about the intersections of aging and diversity, it's really important that we think about the whole person and, all the different identities that that person may hold and how they can be a place for resilience, but also a place that they may experience barriers to care. And so it's really important that we take that person-centered approach, with our aging and disability services. So this guide takes a look at intersectionality. It provides, again, facts on aging and diversity, shares ways that folks can start to assess the community needs. And again, it ends with those inclusive planning goals and objectives, as well as additional best practices. So our organizations wanted to, again, be a partner in this work and not just tell people how to do the work, but provide those resources and examples of how the work is really being carried out on a day-to-day basis. And then one of our newer guides that we just developed is called Local Community Advocacy, advocating for the needs of LGBT older adults receiving aging services. With the first LGBTQ Inclusive Older Americans Act, it was also an opportunity for us to speak directly to LGBTQ older adults and aging providers. And this guide helps to really set that framework of how LGBTQ older adults and allies can get engaged with advocating for their needs on the local level. I worked for a number of years in the disability field, and one of the really, I think, kind of the mantra that comes out of disability work is nothing about us without us. And so we really want to encourage LGBTQ community members and their allies to be at the table, to be a part of the solution. And we also recognize that the aging network can sometimes be really complicated and hard for people to navigate. So in this guide, we provide an overview of local aging services. What does the aging network look like? How is the aging network funded? What are the opportunities for LGBTQ older adults to be at the table through volunteerism? They can, volunteer to serve on boards of directors for senior centers and other aging nonprofits, for their area agency on aging. Oftentimes there's advisory councils. We also highly advocate for LGBTQ older adults and allies to look at ombudsman opportunities. As we know, one of the biggest concerns for LGBTQ older adults is within long-term care. So becoming an ombudsman, can create that opportunity to advocate, for the needs of LGBTQ older adults at a time when, they're oftentimes completely reliant on others for their care, and they've left their home and are now living in a skilled nursing community. So, those are some of the different types of volunteer opportunities that we encourage people to be a part of. And we close out this guide with, action steps that community members can take. For providers in the room today, this is a guide that you can take to talk to potential volunteers, to do outreach to LGBTQ older adults about volunteer opportunities that you have, and to think about ways that you can help encourage that volunteerism within your organizations as you work to become more LGBTQ inclusive. And another guide that we recently developed that we're really excited to share is how to be an ally to transgender older adults. This is an area that I often have received phone calls from providers in the community, wondering how can I support a person who identifies as transgender? Or we receive calls from folks whose transgender loved one has been turned away from services because they identify as transgender. And we heard of a case most recently out of Maine for a person who was seeking housing in a skilled nursing community, and they were being turned away. And there's an active lawsuit that's happening in Maine now from a transgender older adult who was denied nursing home care. And I heard of this in Missouri as well. Prior to leaving the local work, we had received a call from a family, and it came to us probably 3 or 4 weeks after this family had started seeking care and support for their parent who identifies as transgender, and they were going on to hospice. And every nursing home that they called for hospice care, once they found out their parent was transgender, they denied them entrance. And they had to go through a series of phone calls and, being turned away one call after another until finally they found a nursing home that accepted their parent into care. And again, this was at the end of life, at a time when people, are in need of compassion and care and support, and to experience that level of discrimination, it's just heartbreaking. And so this was a guide that I've envisioned for a long time in our work. And over this past year, it really became timely for us. And we were able to work with one of our partners, organization called Forge. And they also run the Transgender Aging Network. And so they helped us develop this guide. And it's really to support family members, to support community members, as well as providers, and how to be an ally for transgender older adults. It talks about what an ally is, how you can support older adults who may be going through transition, the concerns that older adults have and how you can be there for them, and then advice for the ally. And so again, we really encourage you to download this guide and see how you can incorporate it as a part of your work. And at the end today, I also have a slide that will invite you to a webinar that we're hosting on November 19th to actually go through this, this guide on how to be a transgender ally for older adults. And so we encourage you to take a look at that. Other ways that you can help be a part of the future of LGBTQ aging is through ongoing program engagement. And there's opportunities with SAGE at the national level, as well as the SAGE affiliate locally here in Missouri, to engage in programs and services that really support LGBTQ inclusion. And if you're not in Missouri, you can go to sageusa.org and find where there are other affiliates across the country. Today we have around 30 affiliates in 22 states as well as Puerto Rico. So we encourage you to seek out those opportunities in your local community. But one of the programs that we started really as I guess, as a result of COVID, was a new program called Sage Connect. And, we immediately knew that, we were already facing great social isolation among our LGBTQ older adults. So when we started to see programs have to shut their doors and go virtual across the country, we knew that we needed to offer something for our LGBTQ older adults. So Sage Connect is a phone or video call support program that matches community members and allies with LGBTQ older adults across the country. I believe the last I heard, we had about 500 active participants who had been matched for the Sage Connect program. But it's something that you can continue to refer LGBTQ older adults to in your local programs. I also mentioned the SAGE hotline, and this is the number for our national SAGE hotline. If you have a program page that offers resources out to the local community, feel free to include the SAGE National Elder Hotline. It's available for LGBTQ older adults, their caregivers, family and friends, anyone who's wanting to speak to a friendly voice about the needs of LGBTQ older adults and they're seeking services, then this is a program that you can call. Again, we saw the numbers just really increase during the pandemic, and I'm just really excited that this is a program that we've been able to support through SAGE. And as Nancy mentioned earlier, I also work with the Long-Term Care Equality Index. This is a joint program of the Human Rights Campaign Foundation and SAGE, and I'm the SAGE lead for this program. The Long-Term Care Equality Index is modeled after the very successful Healthcare Equality Index for the Human Rights Campaign Foundation. And we started this program in 2019. And what we do is we identify long-term care communities across the country that want to be more inclusive and supportive of LGBTQ older adults in their communities. So we're working with retirement communities, assisted living, skilled nursing, and senior housing providers, as well as facility-based hospice communities. And the goal is to identify groups that are not only committed to LGBTQ inclusion, but they're living that commitment. And by that, I mean they're looking at their policies and procedures. They're, taking steps to meet best practices that we've identified for true inclusion of LGBTQ older adults in residential communities. And they're also continuing to really make a commitment through training and education for their staff and leadership. We just released our first report of the Long-Term Care Quality Index, and it was really kind of a look at the state of LGBTQ aging within residential communities. And we had over 96 organizations and systems that signed on to this first equality index, and this work will only grow. The first 96, I believe it totaled around 150 actual locations for long-term care communities. And since that report was released in June of 2021, this number has now grown to over 500 actual locations of long-term care communities that want to be a part of this work. And I would say, if I could summarize my goal for this work, I think the most important thing is that people have choice. And so as we think about aging in the community for LGBTQ older adults, they should be able to look around their community and have choice in where they will go should they need to leave their home and move to a long-term care community. And a choice of places that are truly welcoming and committed to LGBTQ equity and inclusion. And so that's really my goal in my work with the Long-Term Care Quality Index. Another way that you can, be a part of the future of LGBTQ plus aging is through training and credentialing. If you work for an organization, if you have a professional development that you're committed to every year, think about engaging in education around LGBTQ plus inclusion through our program Sage Care, which can be found at sageusa.care. We have a training and credentialing program where people can take classes as an individual or again as part of an organization in their professional development programs. For organizations that complete the Sage Care program, you're also listed in a directory so that folks can go and find organizations that have made this commitment to ongoing education and cultural competency. So again, I would encourage you to check out that program. If you work for an ACL funded program through the Older Americans Act, such as a state unit on aging, area agency on aging, ombudsman program, aging and disability resource center, independent living centers. We have a free of charge webinar series that we also offer to help ensure that those organizations have an opportunity for LGBTQ plus inclusion and education. So we encourage you to check that out as well. So what are some of the action steps you can take as an individual? Commit to LGBTQ plus inclusivity at work and in the community. Think about things you can do today to help ensure that you're being inclusive of LGBTQ plus older adults. Download the guides that we've talked about here today and share those with colleagues. Each one of those guides has a series of best practice steps. And oftentimes organizations will take a look at those best practice steps and really start to use that as their guide and their benchmark for how they can be more LGBTQ plus inclusive. Be an ally for transgender older adults and all LGBTQ plus older adults. When we stand with people, when we support people, we really make the community a better place for all. So I encourage you to look at the ways that you can be an ally for transgender and all LGBTQ plus older adults. Make referrals to LGBTQ plus supportive aging services. Through programs such as Sage Care and the Long-Term Care Equality Index, you can help people to start to navigate and find services that are truly inclusive and welcoming. And hopefully your organizations will be one of those organizations that's truly inclusive and welcoming. And then stay engaged through education and research. You know, we talk a lot about cultural competency, and I like how some places have really started to reframe that concept, that it's really about cultural awareness and humility. And to be culturally aware and humble, we have to continue to commit ourselves to ongoing education and research. So I encourage you to do, you know, some of these things to start, you know, to take those action steps to be more LGBTQ plus inclusive. And I said that I would share the webinar that's coming up. It's on November 19th. It's how to be an ally to transgender older adults. And, you know, we invite you to sign up for this webinar and join us, you know, in this journey for better support and inclusion of our transgender friends and family members in the community. And that brings me to the end of my presentation today. Again, just, you know, wanted to share that really when we think about the future of LGBTQ plus aging, it's about all of us. We're in this journey together, and I invite you to be in this journey with us and to truly commit to being LGBTQ plus in the work that you're doing, and to help the future be a brighter space for all LGBTQ plus older adults. Thank you.
Thank you, Sherrill. Perfect timing. We have about 20 minutes for some Q&A. If you all would either put a question in the Q&A or the chat or raise your hand, Natalie and Emily will be looking to keep track of that and bring you off mute so you can ask. And while you're doing that, putting up your hand or putting in a question, Sherrill, I'm going to start us off. I have a list of things that I'd like to ask you about, so we'll see. I hope other people do as well. Can you speak a little bit about intergenerational relations within the LGBTQ plus community? You started off telling us that the word queer has been an uncomfortable one for older folks in the community, and that's beginning to change. But what other kind of intergenerational issues are there between such a long history, you know, of development in this community? Can you teach us about that?
Yeah, you know, I like to talk about multi-generations versus intergenerations, because I oftentimes feel like we get kind of stuck with youth and elders. And we oftentimes leave out this middle generation. And I think one of the biggest concerns across society is ageism. And it's ageism towards older folks and ageism towards younger folks. And who perpetuates that? The middle generation, in my opinion. So I think we have to include, you know, this multi-generational approach. And you know, I think today one of the big differences that we're starting to see is, you know, your oldest LGBTQ folks, they oftentimes talk about not knowing that there was anybody else like them. So when they were growing up, they oftentimes thought they were the only, you know, lesbian for miles and miles and miles and miles, or the only one ever. You know, they didn't have possibility models. Today, our younger generation, you know, they know that they have LGBTQ plus, you know, aunts and uncles and grandparents and teachers, doctors, you know, so they're seeing a different possibility model than what our older adults did. And we also know that, you know, the younger generation, they want to learn from the older generation. And so it's important to provide those opportunities where people can share their stories and life experiences. I think some of the most powerful conversations we've seen is where you have, you know, multiple generations of LGBTQ folks talking about what it was like for them, you know, to come out, to grow up, to find their way in life. And so those types of relationships are really powerful. And Sage Connect, which is one of the programs that I talked about, part of its model was to engage the younger generation in making the actual phone calls and support calls to LGBTQ older adults. So that was actually an intergenerational volunteer opportunity that Sage created.
Natalie, if you see any questions or hands, could you help me see those?
Yes, yeah, we're good right now.
Great. I guess I always thought, Sherrill, and this was an old idea, that the LGBTQ plus community itself is just as ageist as the rest of us. In
Yes.
terms of younger, in terms of, do you think that that's changing? I think an old idea was that LGBTQ people really valued youth and health, as much as anybody, if not more, in the community. So I'm wondering how we're standing with ageism within that community.
Yeah, I would. Yes. I think that continues to be true, not just only within the LGBTQ community, but, also, across society. There is this intrinsic value that's, really focused on youth and looks and, how physically fit you are. And I think a lot of it also is because we don't have experience with being old. We have experience with youth. We know what that was like. We can recall that part of our life, and aging can be scary. And so I think that really perpetuates this sense of ageism because we don't have that lived experience. Even I think in gerontology, schools, I remember being there at the Brown School, and I think my cohort at that time, when we graduated in 2008, there were 8 of us who were in aging and gerontology.
Mhm.
Out of 400 students, only 8 of us. And to me, that's also a sign of ageism.
Right, yeah.
know?
And that remains true today.
Yeah, so it's easy to, I think, to focus on things that we know, and it's scary to focus on things we don't know. And so I think that's where part of the ageism comes in.
Yes, thanks for that great answer. I would like anybody else to jump in because I'm hogging the stage here, but I know that you are putting out kind of preferred providers, maybe credentialed providers, because seeking healthcare has always been a hard and intimidating thing. How do we so I could, if I need to make a referral to someone, I know how to find it. How do we encourage providers to get on this list? How are we doing getting individual providers? And just even thinking about St. Louis as a doctor or physical therapist or, any provider to say, wow, I need to figure out how to do this so that I reduce the stigma, the fear of LGBTQ plus people coming to my office.
Yeah, if we think about the healthcare quality index that HRC started 20 years ago, maybe. I mean, it's been a while. It's been around for a while, 15 years. They started out with 70 hospital systems across the United States. 70. Today, they are actively working with around 2,000 hospitals and systems across the country. It takes time, and it takes, committed professionals like us who are taking those steps internally at our organizations to say, how are we reaching out to LGBTQ older adults? If there's a provider on the call today who works for a long-term care organization, a residential community, go to the LEI website, thelei.org, share about what you learned today in this presentation. Share that website with leadership at your organization and encourage them to become a part of the long-term care quality index. We've trained thousands and thousands and thousands of people, and the list of credentialed organizations across the country really does continue to grow. And it's word of mouth. It's people like us that want to be an ally and really step up.
Is there still pretty good resistance from provider communities? I'm sure there is.
Yeah,
but I guess
yeah,
I'm just
yeah.
wanting to hear, what that
Yeah.
looks like and
Yeah, I mean,
progress you've seen.
there's resistance, but also there's hope. I think one of the things that I would share, I currently am supporting 3 older women just as friends that I've known over the past 15 years or so. And I actually spent about 5 days in the hospital with one of the women here recently, just last week. And the level of acceptance that I saw from the healthcare and aging providers over the past week really brings me great hope. And I was sharing with some friends just this past week that, we wouldn't have seen this 10 years ago. People would ask, are you married? Yes, to her wife of 46 years. And they would start asking about that relationship. And just that level of acceptance was just really hopeful that we are seeing this shift.
Yeah, that's terrific. I think that, I've been sensing that too. And thanks a lot to your work. I'm wondering about best practices. You have lots of best practices in the resources that you're providing. What can you give us a sense of sort of the most take-home message for all of us in terms of the top 2 best practices across all these settings?
Yeah, I would say for me, the top 2 are going to continue to be the same. Does your organization have an inclusive non-discrimination policy that identifies sexual orientation and gender identity? If not, then it's hard to claim that you're inclusive because it all starts there. It starts with our policies and procedures and how they're implemented. And the LGBTQ plus community continues to look, for organizations and programs that are explicit, in that non-discrimination statement. And so I think that's number 1. Take the time to do the work to make sure that you're truly inclusive. It's not enough just to put a rainbow sticker on the front door or put a rainbow flag, on your lamppost outside the building. We have to make that commitment. The other thing would be committing to LGBT inclusive training and education. Organizations, if they haven't taken the time to provide that level of training and understanding to their staff, then they're doing a disservice to their employees as well as the LGBTQ plus older adult, because there are still people that need that level of education and support from a training perspective. And if we aren't providing to our employees, then we're not really, living that commitment to LGBT inclusivity.
That was very helpful. Thanks. Natalie, I think you have a question.
Yeah, Cheryl, kind of playing on just what you were just saying a bit. Is there anything in particular, because I know we definitely have a few medical providers in particular on the call. So tying into a little bit of what you said about, some of your policies and going above and beyond having the rainbow sticker on your office door or whatever it might be, are there other best practices or suggestions you would make toward being an ally and making that known to your patients and clear, and also maybe working with family members to be advocates and different things along those lines for medical providers in particular?
Yeah, definitely. In a medical setting, again, it's looking at your intake forms. If, because a lot of times that first time that a patient comes in for care, they're going to be handed their intake form as a new patient. What is on that form? Is it inclusive of sexual orientation and gender identity? When we talk about relationships and next of kin, or emergency contacts, is it truly inclusive? And we are seeing that more today. And what I mean is, before it used to say married, single, divorced. And if you click marriage, then husband or wife. Well, married, single, divorced, spouse. Who is your spouse? Instead of next of kin, who is your emergency contact? What are your pronouns? Those are all things that we can do to help make sure that LGBTQ plus people feel seen and heard. And I think from a provider standpoint, know that especially when we're talking about aging, and not just aging, but really anyone who's coming into care, they may feel comfortable to come out to you as a provider, but that doesn't mean that they're out to their family. So before you disclose a person's LGBTQ identity, make sure one, does it need to be disclosed? And two, do you have that person's permission to disclose that information?
Thank you. Any last questions for Sherrill?
I have another one to add on to that,
Yeah.
Cheryl, a little bit as well. So obviously, again, you were talking about kind of best practices and things at the organizational level, but what if, you as a employee or somebody else at an organization feels very strongly about this and maybe meets some resistance from somebody, higher up in the organization or something like that? Any resources or trainings or recommendations kind of along those lines for, to kind of help build these practices and policies within your organization, even if you're technically not the one to make those decisions?
Yeah, thank you for that. Again, it's hard when we hit that resistance, but having allies inside the organization is critical. Don't give up. Try to find other folks that also want to be an ally in this work. Offer to do a lunchtime seminar, to your colleagues. See if there are other resources that you can help provide. Again, it's hard when you face that resistance, but it takes time. And even with our work with the long-term care quality index, we fully expect organizations to take 2, 3, 4, 5 years to actually get through the process of implementing truly inclusive LGBTQ policies and procedures. And it's just persistence. And then again, if you find an organization that is just not committed to equity, then I think we also have to kind of stop and ask ourselves, is this a place we want to be? If they're not truly being supportive of the community. So find other allies that can join you in this work, and just be persistent.
Thank you.